Hi there, I'm Dr. Kim Langdon with CCM Health, and today we're going to be discussing hyperlipidemia, or otherwise known as high cholesterol. We'll just talk about what causes it, what are some of the symptoms or signs, some of the consequences or complications of high cholesterol. Okay, so lipids are fats, and cholesterol is a type of fat. So we're talking about elevated lipids in your blood. So what is cholesterol? It's a waxy fat-like substance that's found in almost all cells of your body. It's highly necessary for a lot of bodily functions. It helps us make hormones such as vitamin D and helps us digest our food. There's also triglycerides, are another type of fat, and is considered one of the most common types of fat. You can get this from your diet in the form of butter, oils, and other extra calories that you may take in with your diet. There are types of cholesterol. You've probably heard of these before. The HDL, LDL, and VLDL. Those are all forms of cholesterol. The HDL stands for high density, and that's considered the good cholesterol. So equate high with good, right? Then the LDL is the low density lipoprotein, and that's considered the bad cholesterol. So we don't want high levels of that. We want low LDL, and we want high HDL, right? Then we have VLDL, which is a very low density lipoprotein, and it pretty much carries the triglycerides in the blood, whereas LDL carries the cholesterol. And then a chylomicron is just a little carrier vehicle for fat. It's sort of a protein covering a fat so that it can travel throughout your body and your bloodstream. Comes from your intestines. That's how the fat gets absorbed into the bloodstream, and it goes to the liver and to fat cells. So hyper, of course, means excess. So there's primary forms of hyperlipoproteinemia. So since the proteins are usually attached to the lipids, based on genetically determined attributes, primarily mutations in your DNA. You can also have aggravating factors from the environment, such as excess fatty diet, alcohol intake, and drugs. Certain hormones can raise these levels as well. Then there's secondary hyperlipoproteinemia, and those are associated with things like hypothyroidism or low thyroid levels, diabetes. Nephrotic syndrome is a kidney disorder where you pretty much filter protein inappropriately. You lose a lot of protein in your urine. Biliary obstruction has to do with your gallbladder and liver, and pancreatitis is, of course, the organ that is responsible for producing insulin as well as digestive hormones. And the last one, dysglobulinemia. I wouldn't worry about that one unless your doctor tells you have it. So there's these familial types, and we'll look at the 5 different types, but type 2A and 2B are the most common, and it has to do with receptor deficiencies for type 2A, which results in elevated LDL. Remember, that's the bad cholesterol. Type 2B is a very common one, and it's a combination of a receptor deficiency and an increase in ApoB, which of course elevates the LDL. Then there's type 4, familial hypertriglyceridemia, which is common, which is basically elevated triglycerides. So the most common cause of high cholesterol is an unhealthy lifestyle. Saturated fats are commonly found in meats, dairy products, baked goods, processed foods, and trans fats are found in some fried and processed foods, and they can elevate your cholesterol. Lack of physical activity will cause you to have less of the good cholesterol, right? So increasing your physical activity will raise your HDL levels. Smoking lowers your good cholesterol, so you want to stop smoking. This is important not only for your cholesterol level, but also for cardiac disease, heart attacks, strokes, as well as other lung problems. Then there's obesity, excessive alcohol consumption, low thyroid, and diabetes, which could also lead to high cholesterol. And then high triglycerides are probably just really a result of excess calories, because what you can't burn off in glucose is going to get converted to triglycerides and get stored as fat. So of course, excess calorie intake, obesity, smoking, alcohol, all of which add extra calories. Well, not the smoking, hypothyroidism, and poorly controlled diabetes, and liver and kidney disease can also contribute to high triglycerides. This is an interesting chart. It sort of talks about all the medications on this left side, and then what it does to the different levels of the cholesterol, the total cholesterol, LDL, HDL, triglyceride, and the VLDL. What's interesting, even all the green is increased, but just because it's increased doesn't mean it's good. For instance, look at anabolic steroids. That increases the LDL. Well, that's not good, right? And it decreases the HDL. So it has, three adverse effects. So anabolic steroids, bad for your cholesterol. Interestingly, anticonvulsants increase your HDL, so that's helpful, but the next two decrease your HDL, so that's not so helpful. Whether this is significantly related to any diseases, it's unknown. It's hard to study these individual drugs by themselves, so there's a lot of interactions that would result in some confusing results with studies to look at all of these, but we do know that different drugs have different effects on your cholesterol, some good, some bad. So it's now decided that your total cholesterol should be under 200 milligrams per deciliter. And so, as you can see, they just have these cutoff levels that the lab will measure and your doctor will look at. And usually they're given a very extensive printout of all these ratios that often just determine your risk factor and what you should do about it. So the LDL has, very specific ranges, narrow ranges. And so the risk is associated with other conditions. So if you already have cardiovascular disease, then you'll want to maintain your LDL at different levels than if you don't have cardiovascular disease. So this is just telling you, what is considered, very high or almost normal or borderline, depending on your underlying medical condition. So what are some symptoms? You usually don't have any symptoms that you can see except for things on the skin. So you might see excess fat accumulate in the cells of the skin. They can do that on tendons, in the hands, feet, elbows, and knees. There's a picture here of one. They're called tendon xanthomas. There's eruptive xanthomas, which are like firm pea-sized bumps, kind of pink with a creamy center. That's the excess lipid. They don't usually cause a lot of symptoms. They just probably look annoying. Then your palms, if you look at your palms, you get yellowish lesions there. And that can be a sign of a very specific type of lipid disorder. And then at the bottom of your feet, you can have some deposits as well. And also you can get these on your eyelids that look like little styes, but they're just little fatty deposits. And you can get rid of them mostly with trichloroacetic acid. Don't try that at home, especially around the eye. Okay. So the most common complication is atherosclerosis. Shows you on the right here varying degrees of plaque buildup in your arteries. If your heart arteries are affected, you can get what's called coronary artery disease, which is, blockage of the coronary arteries. And if left untreated or if it progresses, it can cause a heart attack or a myocardial infarction. If the arteries to your brain are clogged up with this, it can lead to stroke. You can have weird numbness or weakness in your arms and legs, trouble speaking, temporary loss of vision in one eye, or drooping of the muscles such as the cheek or the lips. You can get arteries that supply your big muscles in your legs. So when you start walking, you can get what's called claudication, which is pain from diminished blood flow and oxygen to those muscles. And if it affects the kidneys, you can of course get kidney disease, and then that worsens your high blood pressure if you don't already have high blood pressure. Type 2 diabetes is the kind that is primarily linked to obesity and diet. And that is linked to high cholesterol as well, which makes sense. So you should keep your blood sugar in control, because you have an increased risk of elevated cholesterol, and the combination of diabetes and cholesterol raise your cardiovascular risk. Of course, high blood pressure is also bad for your heart. If you combine high blood pressure with high cholesterol, that increases your cardiovascular risk, such as heart attacks and strokes. It just makes it harder for the heart to pump blood out to the tissues that need them. The cholesterol comes from your diet, but is also made by your body. So they tell people to avoid certain foods that have a lot of animal products or tropical oils, such as palm oil, cheese, anything high in saturated or trans fat. And you should really go more towards the lower fat, the unsaturated fats like fruits, vegetables, lean proteins. But the majority of the blood cholesterol is made in the liver. So you can't control a lot of it, and that's where the genetics come in, but you can modify your diet accordingly. And of course, exercising and staying physically active are very important. It's recommended 40 minutes of some moderate to vigorous walking, 3 to 4 times a week. If you can do more than walk, if you can, ride a bike or other things, that's just as good as is swimming. And then even as little as 10 minutes a day of walking can be beneficial to your heart and your cholesterol levels. Weight loss, we talk about this a lot. Because weight gain is a gradual process, it happens over many years. It's best if you are seeking to lose weight that you do it on a gradual basis. It's more likely that you'll be able to maintain it, and it doesn't put your body in a state of shock when you do these very fast fasting diets that really lower your caloric intake. It just confuses your body, stresses your body, and you're more likely to rebound afterwards if it's not a reasonable way to lose weight. Quitting smoking won't necessarily normalize your cholesterol levels, but it will take away other risk factors, other risk factors for stroke and heart attack. So it's wise to quit that. We know it's hard. Nicotine is addictive, but there are programs that are very highly touted as being successful. You should talk to your doctor about what are the options for you in quitting smoking. So here we go. We're into the medications of what we can do to lower. Not everybody with elevated blood pressure, depending on how elevated it is, needs to do anything. It's thought that dietary changes can help your cholesterol level by about 20%. So we always think if it's not too severely elevated that you start with lifestyle changes. But if that doesn't work, then statins are the mainstay of treatment. Cholesterol absorption inhibitors, fibric acid or fibrates, MTP inhibitors, bile acid binding resins, injectable medicines, niacin, a basic B vitamin is used. And then that last one, which it's an oligonucleotide. And then, of course, omega-3 fatty acid supplements. There are prescription forms of that, but of course, we all know we can get it from your supplements over the counter as well. So statins are the most widely prescribed to treat high cholesterol. They act by limiting an enzyme. As you know, enzymes are important for almost every pathway in our body. So it's targeting a specific enzyme that is responsible for making the cholesterol in the liver. So the goal of statins is to, make less cholesterol from the liver. As you can see, there's lots of them. They all end in statin. Most common side effects are headache, difficulty sleeping, muscle aches, tenderness, drowsiness, dizziness, nausea, vomiting, any GI disturbances such as diarrhea and constipation, as well as rash. Any side effects should be reported to your doctor, especially if you're just starting a new medication, a statin, or if your dose has been adjusted. There are some serious side effects. Myositis is just an inflammation of the muscle. Elevated CPK is creatine kinase, I should say. It's a muscle enzyme that can be elevated when there's inflammation of the muscles. And in severe forms, it can cause rhabdomyolysis, which can lead to extreme muscle damage, and then that can damage the kidney. So it's very dangerous. In any case, any unusual signs or symptoms should be reported to your doctor immediately. And then we just talk about some doses here, and combination dosages and so forth. And drug interactions are always important. Your doctor and your pharmacist will always be monitoring that. But sometimes you'll see a doctor who isn't aware that you're on a statin. So you always need to have a list of your drugs, their dosages, so that anybody that prescribes you an antibiotic, let's say for a sinus infection, knows that you're taking a statin. They might decide to just have you stop the statin for a while or consult your doctor who prescribed it. So this is sort of a list of showing, kind of which drugs you might use if you really, depending on the cholesterol level. So if you really have high cholesterol, then you're probably going to start with a atorvastatin or rosuvastatin. I've never heard of that one, but there's a lot of them out there, and your doctor will probably prescribe one that's generic to start with to see how well it goes. Then we'll increase the dose as needed or add another agent. This just shows you a list. So these bile acid sequestrants, basically what it's trying to do is just bind the cholesterol in the GI tract before it gets absorbed into the bloodstream. The problem is they cause GI side effects, such as constipation, nausea, indigestion, bloating, and excess gas. But they can be very useful, and some people tolerate them quite well. Also, one type will also help with people who have diabetes, so that might be a choice your doctor makes if you have some trouble controlling your glucose. Can have some problems with reducing, your ability to absorb vitamins, so that they may need to be monitored or supplemented. So this is, a cholesterol Zetia. It basically inhibits the intestinal absorption, sort of like the bile acid sequestrants, and it inhibits the cholesterol absorption from the small bowel. It can do more. It can have more benefit than raising the statin dose. So it may be before they raise the statin dose, they'd add a different drug such as Zetia. The PCSK9 inhibitors, they're injectable drugs. Looks like most of them are subcutaneous, which is less annoying than an intramuscular injection. Can be very effective, especially in genetic or familial types of excess cholesterol. So the most common side effects of those would be, cold-like symptoms, allergic reactions, influenza-like symptoms. Here's another type of injection. Again, subcutaneously is just under the skin, like you would administer insulin. You can do it. There's weekly, there's twice a month, there's monthly, all sorts of different ways to infuse this. It can even be infused through an intravenous IV line. In any case, you don't need to worry about the dosage and how often. Your doctor will let you know if this is what is decided. Fibrates they reduce the liver's production of very low density lipoproteins, and help remove triglycerides from the bloodstream. They can have other effects, such as increasing the fibrinogen level, which is a type of protein that makes your blood clot a little bit more. Whether that leads to any significant risk of blood clotting, it's unlikely, especially if the dose is prescribed. You might have some problems with kidneys, so the dose would need to be adjusted if you have some kidney issues. Your side effects may include gastrointestinal problems, muscle aches, heart arrhythmias, rashes, gallstones. And if you already have liver or kidney dysfunction, you should not be using these. Your doctor will be aware of that or will monitor those organs accordingly. Niacin is a water-soluble vitamin type B. It's one of the oldest lipid-lowering agents that we've known and has been shown to decrease cardiovascular morbidity. It helps decrease total cholesterol, LDL cholesterol, and triglycerides. This can be purchased over the counter, and there are prescription formulations as well. I would talk to your doctor before attempting anything over the counter if you're already on a cholesterol lowering medicine. There's immediate release and extended release. The problem, I guess, is some side effects. You can get this sort of kind of intense flushing that makes you feel warm and itching and give you a headache. So if you get side effects from niacin, they're likely not going to continue that medication. The microsomal triglyceride transfer protein, I'm not going to read how it works. The point of the matter is it works in a different mechanism because it reduces the production of cholesterol in both the liver and intestine absorption. So there's some doses of that. Might affect your liver functions. That's what the transaminases are. So your liver enzymes will be monitored and might result in some abdominal pain or some fatty stools, which is steatorrhea. And you might need to go on a low-fat diet to avoid those. Mipomycin is indicated for somebody who has a familial form of high cholesterol. It's a sub-Q injection, and there's some interactions with some drugs. So you have to avoid those drugs when you're taking this, but your doctor and your pharmacist will advise you accordingly. Omega-3 fatty acids, as we talked about, there's prescription forms, Vascepa and Lovanza, but there's also over-the-counter high-quality omega-3 fatty acids. But if you have insurance coverage and this is recommended, this would be a better way to go because, these sorts of supplements get expensive over time. There are some other things out in, Mother Nature that can help. Barley, some types of orange juices, margarines can help with lowering your cholesterol. Psyllium, which is found in seed husk and things such as Metamucil, oat bran. Yeah, we have known that oatmeal and oat bran and whole oats do lower cholesterol naturally. Some patients might be put on other medications depending on what your other cardiovascular risk factors. So, aspirin, low dose aspirin is usually an antiplatelet medicine to help reduce the platelet aggregation, because when the platelets aggregate inside the blood vessels, they can cause small clots. And if you already have a plaque that's building up, that's usually the inciting event for a stroke or a heart attack, is the aggregation of those platelets. So antiplatelet medications that just sort of impair their ability to aggregate are often prescribed in people at high risk for cardiovascular disease. Beta blockers as well are often used for high blood pressure, people who've had a heart attack or have heart failure. Angiotensin converting enzymes or ACE inhibitors help lower blood pressure and have other beneficial effects on heart arteries. And if you've had a heart attack, you'll likely be on one of those. Calcium channel blockers are often used to lower someone's blood pressure and may treat angina, which is chest pain from coronary artery disease. Diuretics help you shed excess fluid from your body, because the more fluid you have in your blood vessels, the higher your blood pressure is. So it helps lower your blood pressure. So that concludes our discussion on high cholesterol, hyperlipidemia. I hope you learned a lot. If you've already taken a medication, then this should help reinforce your knowledge base. If you're considering taking it or your doctor's recommending it, I recommend that you look through the presentation again on our website. I thank you from CCM Health, and we'll look forward to more topics in the future. Thank you very much.